On the 24th of October 1918, at the NFWI's second annual meeting at Cathedral Hall in Westminster, WI members voted on and passed the WI's first resolution, thus establishing the first WI campaign. At this time there were just over 700 WIs and 12,000 WI members. This first resolution was put forward by Epping WI in Essex Federation to ensure the provision of a sufficient supply of convenient and sanitary houses. This was just the beginning, and the last 100 years have seen the NFWI, federations, WIs and members get behind an incredible range of social policy, health, food and agriculture, education, environmental and international campaigns, with WI successes ensuring increased public awareness and important policy changes. 1918 was also when the NFWI started employing staff, with a £2,000 government grant enabling employment of 5 full-time members of staff and 2 part-time. This was a crucial step towards becoming an organisation with the influence and scope that the WI was quickly garnering, as staff were able to manage and oversee the newly implemented resolutions process. The resolutions process means that members play a central role in defining policy and bringing issues onto the WI's national agenda. It is a wholly democratic process and genuinely member-led from beginning to end. Over the following years, from 1919 to 1925, there were 51 resolutions brought to the annual meetings for discussion and voting, and roughly a third of these were about women taking their place in society, encouraging women to stand for election to local councils, supporting the appointment of women to public posts, such as juries and the police force, or about issues specific to women, such as maternity care and pensions for widows. And the successes were tangible even then. In 1919, the first female mayor of Higham Ferris in Northamptonshire was a WI member, and 2 members of the Somerset Federation Committee were elected onto their county council. Not all campaigns garnered results immediately, but WI members have never shied from maintaining pressure until they see a result, for decades if necessary. The 1921 resolution on jury service came at a time when virtually no women met the qualifying criteria. Later, a 1964 AGM resolution led to a decade of campaigning to implement the Morris Report, which called for jury service to be open for all. Pressure from the WI and other women's organisations ultimately resulted in the Juries Act of 1974. Likewise, WI members were among the first to debate on the dangers of smoking by passing a resolution to ban smoking in public places in 1964. Eventually, in 1984, there was a ban on smoking on the London Underground, and finally, in public buildings in 2007. The NFWI's progressive campaigning history is a clear indication of how we have remained relevant since the beginning. Other campaign focuses over the years have included equal pay in 1943, preserving the countryside against litter in 1954, which led to the foundation of Keep Britain Tidy, breast cancer screening in 1975, and the trafficking of women and children in 2004. We were also founding members of the Fair Trade Foundation in 1992. As early as 1922, WI resolutions focused on venereal disease, and in 1986 the WI was one of the first groups in the UK to talk about AIDS and strove to remove the stigma and inform the general public of the true facts of the disease. WI campaign successes are too numerous to list, but notable recent examples are Care Not Custody, SOS for honeybees, and More Midwives, all of which we still work on today. The 2008 Care Not Custody campaign secured government backing and a total of £75 million for schemes to ensure that people with mental health problems that come into contact with the criminal justice system get the treatment and support they need. The SOS for Honeybees campaign in 2009 was instrumental in seeing the government launch the National Pollinator Strategy in November 2014. And the 2012 More Midwives campaign has now seen 2 research reports published, with our findings informing an inquiry from the House of Commons Public Accounts Select Committee. Since the launch of the campaign, the Department of Health and NHS England have also commissioned a new guidance on safe staffing for maternity. We have been trailblazers on many issues, but the success of WI campaigns lies in their substance. Whether there are national policy changes to be made, or a need for heightened awareness and public information, the WI has a unique structure of local, regional and national influence. Since 1918, WI members have refused to concede on matters of importance to them, and this has ensured our continued relevance. No challenge is too great, and no issue is too complex. Our 100-year legacy has shown both the public and those in power that the WI is indeed a force to be reckoned with. And as we enter our 100th year of campaigning, it is evident that this is not a reputation we are in danger of losing.